This is Reframe, the podcast from the College of Education, Health, and Society on the campus of Miami University in Oxford, Ohio. So today in the podcast, we have a really fun episode. Now, often we talk about subjects of health and wellness on Reframe. So today, I'm going to turn the podcast over to a very special guest. Can you introduce yourself?
Yes, my name is Amanda Valentine, and I've had a weight loss journey myself, losing over 100 pounds after a lifetime of obesity and yo-yo dieting. And I've been maintaining for 8 years now. And over the past 2 years, I've started a daily podcast called Pound This, where I focus on health, wellness, and fitness.
Your podcast is very successful. Thank you. We're very excited you're here. Thank you for being here. And I know one of the things that you've talked about is this concept of inflammation, anti-inflammatory effects, anti-inflammatory things. There seems to be this buzz around it now, correct? And that's something you're interested in learning more about?
Definitely. I mean, especially if you're in the social media space, you see that term get thrown around a lot. So what exactly does that mean? Why is that important? And what do we need to do?
So here at Miami, there's a researcher in our Department of Kinesiology and Health, Dr. Kyle Timmerman. He's an exercise science professor, and one of his main things of research is all about inflammation, what it is, why it's good, why it can be bad. So we connected you with him for this conversation, but you also brought along someone with you. Who is that?
That is my friend and personal trainer, Josh Garrett, who is the owner of Cincy 360 Fitness, who is a professional personal trainer, runs a gym with personal trainers, and deals with the everyday public and their inflammation.
So this is a really fun conversation. It was not only about just like what inflammation is and what we can do with that information. I loved how he talked about how that information that they discover in the lab gets out of these academic journals and actually into the, general public, like to people like Josh who can help people through this, or people who are health conscious that actually can use this information. But you guys also talked about, how to set reasonable, attainable goals, like gaining a healthy perception of what health actually is. And then there's a lot of hard science mixed with practical advice here.
Yeah, it was awesome. I know Josh was very, very excited to have this conversation with Dr. Timmerman. And I think it's just important to know to people that do talk to the general public that's trying to lose weight or live a healthier lifestyle, like myself, I do with my podcast, like Josh does as a personal trainer, to know just what exercise means and the large benefits it has, just even small amounts of exercise, like Dr. Timmerman brings up.
Mm-hmm. And one of the reasons why I'm talking to you now is because you guys were so excited to speak to him. From the moment he walked in to the moment he left, there was really no beginning or end to the conversation. It kind of just flowed on. So we're going to set this up right now. So this is Amanda Valentine and Josh Garrett, both from the Pound This podcast, special guest hosts here on this episode of Reframe, speaking with Dr. Kyle Timmerman.
So what do you teach here?
I teach...
which is maybe part of the podcast now. And we're on.
He's like, I've been recording you guys for 5 minutes. So exercise test and prescription class. So for folks that want to go to become cardiopulmonary rehabilitation specialist or physical therapist, and then I do exercise physiology as well, which is my favorite one because that's kind of more aligns with what my area is, and then I do some research methods classes at the graduate level too.
Okay.
So yeah,
cool.
So it's fun.
So I'm just gonna do. I mean, we're still keep this the same exact vibe.
Yeah.
I just wanted to just introduce ourselves that we're doing Reframe, and then I'm just gonna just ask you about you and your research and what you do here at Miami. Talk to me like I'm 5 questions about inflammation, and then I just want to have a roundtable discussion about. What does that mean for
I was
us?
just initially, I love that you guys said, hey, I'm interested. I'm like, oh, it's great. Because it's always such a misunderstanding with students and just with the general population. I always ask my students, who thinks inflammation, is it good or bad? 99% of the hands go up for bad. So that's, I guess, to your first question, my research is focused on chronic low-grade inflammation with aging. So we know that as we age, that our baseline levels of inflammation creep up. And that's in reality, when we talk about inflammation in the bad context, it's when our baseline levels of inflammation start to creep up and it predisposes us to, you name a chronic disease. And maybe we'll talk about some of the specific ones over the course of the podcast here. And then we also know that people that are more physically active avoid that. So it's not just one of those things like, oh, I'm getting older, my inflammation levels have to increase. It's a host of things, kind of like you were saying when we were talking a little bit ago, that health is kind of factorial. So, being more physically active can help prevent this increase in chronic low-grade inflammation. We know that a healthier body composition can do that. Different aspects of diet can influence it. But we don't really know what it is about physical activity that's reducing that inflammation. So that's kind of where my research is at. That's what's fun about just science in general. It's like, okay, we know there's this benefit, but we don't really understand why it's occurring. So that's the general focus of our research right now.
So I guess it's just to totally dumb it down for a question of just what does general inflammation in the body mean? Where is it why is your body getting inflamed in a negative way?
Yeah, so it's just, kind of start with when we think of inflammation, people are like, oh, my achy joints, or, you'll hear about the pain, redness, swelling. And so it's all those things. So all of us, even if we're healthy right now, we don't have any sickness, we have some level of inflammatory proteins in circulation and in our tissues, but that's pretty low. When we're absent of any illness at that time or any injury, our baseline levels of inflammation are pretty low. But if we do get sick, we see a spike in inflammation, acute spike, and that's critically important, I should say. It's actually part of the immune response that helps resolve the infection. It's think of it as kind of like the fire alarm for, hey, we've got an infection in this part of the body, or we have a systemic infection, a bacteria or a virus. And so inflammation helps recruit cells of the immune system. It helps make those immune cells mature and helps resolve that infection. And then you'll see the levels of inflammation go back down. Now, people always ask me, my joints ache. And, kind of as we age, the increased risk of osteoarthritis, and inflammation is there too, because inflammation is critically important to tissue repair. So when we're young, if we injure our knee or injure our hip or injure our back, we've damaged some tissue. Yeah. And inflammation levels will spike locally and actually helps repair those tissues. So it actually helps degrade the damaged tissues and initiate repair of those tissues. And so I don't know about you guys, when I was 20, that felt like 30 minutes, right? And the tissue would repair. But as we age, if you damage your hip or your knee, that inflammation will be initiated, but then maybe now your body can't repair that. And so what happens in inflammation? It just stays elevated in your hip or your knee, and it stays elevated. And with that continued elevated inflammation, it's preventing, we want that inflammation there to clear away damaged tissue, and then the inflammation will drop, and then synthesis will occur. But if we're not able to repair that tissue, inflammation just remains elevated, and repair never occurs. So it's just that high inflammation is then just starting to even not only degrade damaged tissue, but it's starting to degrade healthy tissue as well.
Well, just as a personal example, for me, I've been having all these problems, specifically with my right knee. I had to get an MRI. I'm told I have pretty much bone on bone. I have arthritis. I have an ulcer in my knee, and yet I have a lot of inflammation going on. So at what point where do I use exercise in there? Because it hurts and it's painful. So at what point am I helping reduce inflammation, or just making it worse and grinding my knee out more?
Yeah, and so that sounds like classic osteoarthritis, right? And so we got to find ways to try to reduce that inflammation. So sometimes the doc will say, okay, we're going to go in, we're going to do a cortisone shot, right, to try to artificially reduce that inflammation. And sometimes people will be like, I have a hip issue myself, and so I've had those injections. I'm like, I'm cured. For 3 months. I'm like, this is amazing. And then 3 months later, that wears off and the inflammation returns. Mm-hmm. Now, for exercise, that's an excellent point. Exercise should be anti-inflammatory. We know from research that people that are more physically active or who have arthritis and begin exercising, it reduces pain, it improves function, but you have to be mindful of what you're asking them to do.
Right.
So, you can't just say, some people are so focused on, okay, the ACS, the American College of Sports Medicine, recommends 150 minutes per week of aerobic exercise. So, go on a treadmill. It's like, well, maybe for you, with your knee like that, doing aerobic types of exercises that are less weight bearing. I think you said when we were talking earlier, went to
a water aerobics class,
yeah. Right? Mm-hmm. And so that would be kind of recommendations you would make for somebody in your case that said, hey, we know if you were exercising, we can help reduce that inflammation, we can improve your function, reduce your pain, but you got to be smart about it. If I would say to you, okay, I think I'm going to have you start just jogging on a treadmill like crazy, that's going to be your exercise. that's not going to help. That's going to have more bone on bone and going to cause some more of that localized inflammation.
Yeah.
So exercise is anti-inflammatory. Exercise training, I should say. So yeah, it can help, but you have to be mindful of what the exercise is that you're asking somebody to do.
So when you refer to exercise, I think that's such a broad topic that so many people put a negative connotation to that, right? Like it's like, oh, I'm just going to go in there and get destroyed in the gym.
Yeah.
That's not what you're referring to.
No. I guess I should say more specifically physical activity. And I talk about this with my students as well. You know, people look at exercise, jokingly say it's like a 4-letter word, right?
Yeah.
Then if you package it better and say physical activity, that's much more, you know, kind of manageable for them, and talk about activities that they like to do, that they'd be capable of doing given any conditions they might have. So yes, when I say exercise, I'm not saying, hey, go get a gym membership at 24 Hour Fitness or hit the rec center all the time. Majority of the population could get the exercise they need outside of a facility.
Parking a little further away.
Yeah, exactly. And you know, all the studies showing that physical activity reduces chronic disease, the majority of those studies have, you know, the exercise they're doing is just walking. And it's not walking on a treadmill. It's just, hey, try to get up more during work, take a 5-minute break before or after lunch. There's some really cool studies out now that show that, you know, even smaller bouts, just 2 minutes of exercise, provided that it accumulates over the day to, you know, 30 minutes or so total, can have the same benefit as, hey, hop on the treadmill and go for 30 minutes in one chunk.
So instead of checking Facebook, you could take a walk up the steps.
Yeah. Oh, yeah, absolutely. And, you know, it's, you know, just encouraging people there's a compelling body of evidence out there. It's like, you know, you are drastically reducing your risk of chronic disease if you, like me, I sit 6 hours a day writing about the benefits of physical activity in my office. And so it's, you know, just being mindful of getting up, you know, periodically. And studies have shown, that helps. That really helps.
Well, it's like, I think that anti-inflammatory seems to be such like a buzzword now. So with doing all of this research, you know, I think that's important. I mean, and even like I said, all this buzzwords of anti-inflammatory, for me, just as just a random person, I haven't heard all of this research about exercise. So how are you getting your research and everything that you've known and all this, you know, proof of that exercise helps in this? How are you making sure that people like Josh, who is like training people, has that information so that you can pass that along of how important exercise is?
I mean, you hit on a really important topic, because in you know, in science and research, a lot of us are just like, I'm over in Phillips Hall and I'm down in a little dungeon. We have no windows down there, and we're playing in our labs, and we're finding these results that suggest that physical activity or exercise are anti-inflammatory, and we're writing it to the Journal of Applied Physiology. But how often do you see at the doctor's office the Journal of Applied Physiology laying beside the table, or when you're checking out at Kroger?
Oh, well, I read it all the time.
I know, right? Yeah. And so they're right. It's like, you know, one of the things we struggle with in science is disseminating our findings to folks. So I do try to make a point of, you know, I speak at older adult centers quite a bit. So the Knowles of Oxford, I'm quite at their Oxford Senior Center. I'm going down to a conference in Tampa in March to talk with a panel of clinicians and older adults about the benefits of physical activity as it relates to inflammation in older adults. So we do need to try to find avenues to do that, rather than just publishing papers in scientific journals and presenting at scientific conferences. Because at the end of the day, we do hope that, you know, patients and folks like Josh that are working with people do find out what we're doing. Because that's the whole point of it in the first place, right?
Yeah.
Is to say, hey, this is beneficial. We want to see that, you know, health professionals then are utilizing this information to benefit their patients.
I mean, Josh, how often do you see with just the clients that you have every day or that come into the gym that they have, you know, issues of inflammation, like with me and my knee? I mean, I know in my case because I go to your gym, but like where you know that you have to implement exercise in order to help fix this problem but not make it worse.
Yeah, I mean, I think that in regards to the general population, that's everybody. You know, we put a lot of mileage on the chassis kind of thing.
Yeah.
We've all played sports or we've done something repetitively, a movement pattern that's made the body imbalance in some way, and that causes some aches, pains, and we got to kind of find the right exercises to not exacerbate that, but work around it, so to speak.
Well, with all of the research that you've done with this study and other ones, like how little actually makes like a big difference, especially when it comes to inflammation. I mean, is it just going for a 5-minute walk going to turn the tables for you?
Yeah. So again, that's the biggest bang for your buck is from taking from people that are relatively sedentary to anything beyond that. That's when you're going to see the biggest one. You can convince those people who are really not physically active at all to begin doing that. More specific to your question, it's absolutely appears to be dose dependent. So we've known that for a while. If you look at some classic studies like the Harvard Alumni Study or the Aerobic Center Longitudinal Study that looked at incremental increases in regular physical activity, ranging from no activity at all to 250 or just 500 calories per week, which is not that much of physical activity, the UC risk of mortality, risk of chronic disease rapidly drop. And then if you can get somebody just to do as little as like 1,000 calories per week of physical activity, which translates to about 150 minutes per week of exercise, you can see, again, I'm probably citing the percentage a little bit off, but in the Harvard Alumni Study, I believe that they showed that about a 20% reduction in mortality once you see those people that are doing at least 1,000 calories per week versus those that are relatively sedentary. And then regarding dose again, it's that 150 minutes per week used to be packaged as 5 days per week, 30 minutes on those days. Now researchers looking at what if it was only like you just do 2-minute bouts during the day to add up to 20 or 30 minutes. Is that as effective as if I do 30 minutes all at one go on that day? And it appears to be in terms of reduction of risk of disease. That and again, this is relatively new, that they're looking at. They used to say it had to be 30 minutes or break it up into 3 10-minute bouts. Now research is like, hey,
just get it in.
Yeah, just get it in. If you can get 2-minute chunks here, 5-minute chunk there, as long as it adds up to about 30 minutes per day over the course of the day, the benefits, again, in terms of reduction of risk of chronic disease, appear to be the same as if you would do a 30-minute bout of that same intensity on that day.
Well, I don't know if you want to answer this question or not, but being that this is your job, like what does your exercise routine look like?
So I think I told you that I sit, for the majority of my day writing about, physical activity. And so I'm excited about the fact that there are studies that show even if you have a lot of sedentary behavior, physical activities kind of trumps sedentary behavior to a certain extent. So you can have a lot of sedentary time, and a lot of us are going to as part of our jobs. But if you can get that physical activity in, that's, again, a more powerful lever than being sedentary. Being sedentary is not good, obviously, but just getting any amount of physical activity is good. So me personally, I do 3 days per week of resistance training. I enjoy that more than aerobic exercise training. And then in terms of packaging, this is for me selling it to myself to do. I know it's important for me to do aerobic exercise, but I hate doing it. And I used to get it from like sports.
Yeah.
And then as I start to have more aches and pains, I can't play basketball as much because of hip issue, and tore my Achilles right after I turned 40. So I hate treadmills and I hate bikes. So I get mine from 2 days a week doing high intensity interval training on a bike, and I'm done fast. Even though I don't necessarily enjoy it, I do kind of enjoy, that I enjoy that vigorous intensity effort in doing it, and it's over in a shorter period of time. And I know that I can get the same benefit from doing it 2 days per week because I'm doing the high intensity type that I would get from doing, 5 days per week of walking on the treadmill for 30 minutes at about, which just makes me sleepy, even saying. So that's mine.
No, but I think that's important just because I think that, I'm sure you can speak to this too, Josh, of being where your profession lies within exercise, where it's good to be honest of like, I hate doing this kind of exercise, but this is kind of my mental gymnastics I go through, because I feel like so many people, like the general population, including me, would be like, I don't like doing this. It must be my fault. This is my thing. No. It's just these other people are just inherently born to love to exercise and grind hard. And what's my problem?
Yeah.
You know what I mean? So I think it's to be like, you work in this profession, and this is something that you're passionate about, and that it's not like you're like, oh my God, all I want to do is exercise all day.
No, it's not. I enjoy it, and I definitely like feel the benefit of it. But yeah, there's aspects of it that I don't like. I'm sure Josh knows. There's days I'll roll in there and I'm like in there for 10 minutes. I'm like, Nope.
Absolutely.
It's not happening.
There's so many times that, we've walked into the gym and it's like, after you train somebody or you've trained for hours, that's the last thing that you want to do. And people are like, oh, you don't understand. It just comes easy to you. It's like, no, we still got to make those choices too.
So it is just a matter of packaging. Because again, I think the recommendations, people Google physical activity recommendations or exercise recommendations, that 150 minutes per week that you see by the American College of Sports Medicine, the American Heart Association, if you just look at that, that can be kind of intimidating to folks. So again, in terms of disseminating to the public, this is kind of the things we'll hope will break through. That hey, you can get it in smaller bouts.
And it's subjective person to person.
That's right.
It doesn't have to be this intense, crazy workout.
Yeah. And people always ask, what's the best exercise? It's literally, it's the one that you'll do.
Right.
It's the one that you'll do. And so just finding out what you enjoy. I would tell my students in class, I'm like, you might be giving grandpa permission to golf more. If you're like, hey, you don't have to go to a gym, just golf more. Just make sure you carry your clubs. It's like, what? That's it? I'm like, yeah.
Walk
That's
9.
it. That's going to be within, walk 9 instead of do it. And then there you packaged it in a way that they're like, oh yeah, I'll go do it.
Did you have any more questions, Josh?
I do have a question.
Yeah, fire away.
I don't know how much you've studied it.
Yeah.
But in my area, it seems like we have a spectrum, right? We have people that aren't moving a whole lot, and then we have people that are using exercise almost in a negative way, right? Like they're coming in 6-7 days a week. If they don't get their workouts in, they're going crazy.
Yeah.
Is there a threshold that exercise becomes negative on inflammation?
Yeah. So, yes to inflammation, and yes to more things than just inflammation. So in exercise physiology, again, not to bore folks with some exercise physiology jargon, but we kind of call it the J-shaped curve. Yep. Right? And so if on the y-axis, if you're looking at risk of infection or inflammation levels, we know that people that do, are hitting the recommendations are at a decreased risk of disease, probably have lower inflammation than those that are sedentary. But if you start going out to those folks that are doing, like you said, 6-7 days per week of high volume, high intensity exercise, now that population's a small portion, but there are definitely those. We know that in athletes. So if a lot of times this is done like cross country teams that are doing high volume, high intensity exercise. We know that they're increased risk for infections compared to folks that are getting enough exercise, and sometimes in case of those that are sedentary. So they've pushed beyond. Now they're having a net detriment. Now, if you're looking at people for resistance training, they want to increase their muscle mass and function. That recovery is equally as important, right? Because you're initiating that damage of the tissue, then you have to break down the tissue, and then you have to have inflammation go away so that you can start to have the synthesis of new muscle tissue to stimulate that muscle hypertrophy. Yeah. And so, again, that's kind of the whole concept of overreaching or overtraining. And so, again, that's a real small percentage of the population, but can you get too much exercise? Yeah, you can. People can overtrain and overreach and feel sick as part of that. Yeah. Especially if your intensity is high on the exercise you're doing and there's not adequate recovery time, then you can start getting some of those detriments.
Yeah, but that does get scary because, especially if you look like in the online world, there's like this no rest days, go hard, bro, sort of, here's pictures of my muscles on Instagram. That's because I live in the gym sort of mentality that it kind of puts out that if you don't go hard 7 days a week, then you're weak. You know?
Yeah, and it just have to, those are things that, is one of the things that makes kind of, my life harder and probably Josh's life harder is those things like that. The perception of what healthy is, right? And so, you'll see those folks, showing their gains in the gym or something like that. And then you'll try to talk people into exercise and they have the perception is that's what it is.
That's what I have to do.
And that's what my ultimate goal is to look like or to be like. And if I can't get to that, that can be really defeating, right? Yeah. So I think it's, with my students, I'm teaching them, have reasonable, attainable goals. And so for my students, I try to let them know how quickly do we expect to see improvements in what they're looking for. So if they're just looking to increase their strength, how quickly can we see that? If they're looking to increase lean mass, it's good to let them know, it's probably going to be 3-4 months before you see anything noticeable in that regard. And then it's just good to let them know. Otherwise, if they've gone, I've lifted for 3 weeks, I'm looking in the mirror, and I'm on the scale to tell me my body composition hasn't changed dramatically, that's just too short of a
And that's where I get yelled at.
Oh, that's right. Yeah. But
What do you mean?
Yeah, but I think if you set their expectations correctly to begin with,
Yeah.
then it's more like. But yeah, that's I completely hear what you're saying, and that's just something we always fight against, is that kind of perception of what healthy is and what healthy looks like.
Well, yeah, and that's a discussion that Josh and I have had a lot too, of just this whole, you got to like earn your shower, sweat through your shirt.
Yeah.
Like every time you exercise, it has to be. And that's just like, like a media representation or just through social media, which again, just speaks to a certain population, not to everybody. But I could see where some people would be like, well, I'm not even going to try because if that's what it is, that I have to sweat through my shirt and I have to be dead in order to be active, then I'm just going to stay in my jammies.
Yeah, that's right.
So for these people, one side of the spectrum, we're saying just park a little further away, just walk more, just get some more activity in. And then this side of the spectrum, we're going, hey, you guys need some rest days. You need to calm down a little bit.
Yeah. I mean, again, that gets such a small portion of the population.
That's not the bell curve.
But absolutely. I'll have students who'll freak out. It's like, I've exercised 6 days a week last week. Is that safe? I was like, yeah, it's safe. We're talking about a really small portion of the population that's hitting that overreaching or overtraining.
Yeah.
Well, this has been a really great conversation. Josh Garrett, Dr. Kyle Timmerman, thank you so much.
Yeah, it was a pleasure. Thanks for inviting me.
Thanks.
Dr. Kyle Timmerman is an associate professor of kinesiology and health at Miami University, and Amanda Valentine is the host of Pound This, the health and wellness podcast where Josh Garrett often appears as her co-host. You can find more of their episodes, as well as many more episodes of Reframe, on Apple Podcasts and wherever podcasts are found.